Hello, how are we doing today?
Doing all right.
Okay, can I see your band for me? All right, I'm just gonna scan your arm. Can you tell me your name, please?
William Burrow,
Okay, and what is your birthday, Mr. Burrow?
October 31st, 2001.
Okay, do you know how old you are?
20 years old.
Okay. Do you know where you are?
I'm here for examination.
Okay. Do you remember a recent event such as supper? Do you remember what you had to eat?
Yes, I had lunch a few hours ago.
Okay. Well, what I'm going to do is just do a simple health exam on you. So I'm just going to do a review of all your body systems, ask you a few questions, get you to move around a little bit. Is that okay?
It's fine.
All right. The process is going to involve me touching you. Is that all right?
It's fine.
Okay. So what I'm going to do is I'm just going to start up from your head. Just look through your hair. Make sure that there are no lice, no lesions, no adhesions, anything like that. Does it hurt if I touch anywhere on your head?
Feels all right.
Okay. All right, can I get you to look straight for me? Okay, so what I'm going to do is next do some ocular movement exercises. So what I want you to do is I want you to focus on this pen, okay?
Okay.
I'm just going to move it in a few different directions just to test your range of motion. Okay, now what I want you to do is focus on the pinpoint of this pen and focus on an object at the back. Let's say the television at the back. All right, can you look at the tip? Now focus on the TV. One more time back. And back to the TV. Okay. Now what I want you to do is just keep your focus on the end of this pen right here as I move towards you. Okay. All right. Now what I want you to do is get you to lean your head up for me. I'm going to look inside your nasal septum right here with my pen light. Make sure there's no redness, no cuts or lesions, no abrasions, anything like that. Okay, lean back this way for me. All right. I'm going to look inside your ears, checking for no obstruction, anything like that. Okay. All right, now I want you to open your mouth up for me. All right, shining the light in there, making sure the mucosa is pink. There's no redness, no obstruction, nothing around in there, which is out of the ordinary. Can I get you to say ah for me? Ah. Okay. All right, close your mouth for me. All right. Now, I'm just going to palpate around your area right here, okay?
Okay.
Now, does it feel tender at all?
Nope.
Okay. I don't feel any swollenness, no tenderness. Okay. All right, can I get you to swallow for me? Okay, just monitoring the throat. All right. Check right here. Your pulse. Okay, that's good. Okay. So now that I've done with your face, I want you to see if I can get you to turn your neck for me. Can you turn to your left? Okay, turn to your right. Straight back forward. Look up for me. And then look down. Okay, perfect. All right. Now I want you to take a deep breath in. All right, and deep breath out. Okay. Now let's see. I'm going to put my hands on your shoulders right here. Can you scrunch your shoulders up? Okay. Feeling for resistance. You have this. All right, relax them. Okay. Now I'm going to check your extremities, your arms. Check your fingers. Checking for capillary refill. Okay, that's good. That's 2 seconds. All right. Now, what I want you to do is just right here for me. If I had my stethoscope on, I would be listening to the four corners in his lobes, going down a perpendicular path. Okay, can I get you to stand up for me? And then turn around. I do the same thing, starting with my stethoscope. going in a crisscross motion down the areas of the lobes of the lungs, listening to every time he would breathe in and out. Okay, I'll turn back around and sit down for me. All right, next I would listen to his bowels as well. So in the 4 quadrants, checking for minimal bowel activity, if it was hyperactive or hypoactive. Checking. Okay. All right, moving down to his lower extremities. Of course, he has clothing on. If need be, I would move the clothing up. Make sure that there's no swelling, no bruising, no abrasions at all. If necessary, I will test his reflexes with a reflex hammer, just to click it, and then normally the normal reflex would jolt the leg. All right, now what I want you to do is just stand up for me. All right, so what I'm gonna do is just get you to do a few movements for me, okay?
All right.
Can I get you to extend your arms for me? Okay. Now, can you bring them forward? Okay. Now rest them at your side. Now I want you to stick your left arm out and just do a circular motion. Okay, stop right there. Go backwards. Good. All right, stop. All right, now do your other one. Do your right. Let's go forward. Okay. Go back. All right, very good. All right, now can I get you to pick your left leg up like this? All right, good. Now do your right one. All right, very good. Keep straight for me. Just gonna check that curvature of your spine right here. Okay. Once again, let me see. Shrug your shoulders for me. All right, feel pressure. Okay. Now what I want you to do is to put your arms out like this, and I'm going to put my hands on here. Now whenever I push, I want you to push back, okay?
Okay.
All right. Now you push against me. Okay, good. All right. Now, what I want you to do is we're just going to take a few steps forward and get you to walk back, okay?
Okay.
So, I want you to walk forward for me. All right. All right, we're going to stop. Now we're going to turn around, and we're just going to walk back. Okay. Now, what that was doing was that was for assessing your gait and your posture. All right. Now, I want you to take a seat. Now, as far as my head-to-toe assessment, that's been complete. If necessary, what I'm just going to do is show you the proper injection sites if I were to give you any medicine, okay?
Okay.
So, first we're going to start with the deltoid right here. You want to find the acromion process, which is literally the end where the clavicle is. Put 4 fingers from the top of it, and then this area right here is going to be where we're going to give the injection at, right in that little area. So, using the fat pad for simulation, you want to do it at a 90-degree angle. Stick it in. And for always, every IM, you want to aspirate back. So you're going to pull the plunger back. No blood. You're in the right spot. Instill it with how many ever time that you need to. Pull it out. And then put a Band-Aid over that one. All right. Now that one was the deltoid. Now, I want you to extend your leg out for me. All right, just pretend that it's on a pillow or you're laying in a bed. Next is your vastus lateralis. So, you're going to want to... Actually, no, that's the right one. Okay, let me get you to stand up so that way I can do it for a better picture. All right. So, for this, just going to go up here. We're going to get our landmarks, so your greater trochanter and your patella. Now, normally you're not supposed to be doing this standing up, and I understand that, but let's just simulate this because he's going to be laying on a bed. You want to draw an imaginary line between the spots to mark the landmarks, and it is going to be in the uppermost portion of that muscle. So right around near the middle and the bottom, so kind of in the center right here. All right. Now for the greater or the ventrogluteal muscle. Okay, so what that's going to do is you want to find the greater trochanter. You want to put the head of the femur with the palm of your hand. Put your thumb towards the groin. Put your middle finger towards the iliac crest. Put your pointer finger towards the iliac spine right here. Draw that imaginary line with the triangle, and that spot is going to be right there. Now I'm going to simulate this. You want to go in at 90 degrees. Always aspirate. Instill fluid. Withdraw. Alright, then there's that one, Band-Aid on that one. And then as far as the vastus goes, I know I didn't inject that, but I'm going to do that one more time. So, right there, that spot where I said right there is going to be the stick, aspirate, instill, draw, Band-Aid. Alright, and then if you have insulin, now let me get you some down more. Alright, now if you have insulin, you always want to do it on the abdomen. So lean back for me. I'm going to put this fat right here, just simulate it. It's going to be at 45 degrees if it's on a normal thin client. You're going to do it at 90 if it's an obese. So you're going to want to pinch the skin, stick. You never want to aspirate for a sub-Q. Instill, however many you need. Withdraw. It can be on the abdomen. It can be on the backs of the arms. And then that one was 90. So if you want to do it 45, you want to pinch the skin. Go in about 45 degrees. Pinch, stick, still, and withdraw. Okay. And that was the complete health assessment along with injections of IM and sub-Q. Thank you for being my patient today, and I will come back to check on you later, all right?
Okie dokie.